Welcome to my channel, guys. It's your girl nuellaafolabi. I hope you are all doing well and staying safe. If this is your first time on my channel, welcome, and if you are returning, what's good? Now in this video I'm going to be talking about this life-changing drug called Crizanlizumab, and basically it's for sickle cell patients, people who live with sickle cell disease. Now this drug literally went viral. It was everywhere, all over the Shade Room. It was on Sky News. It was on BBC. It was absolutely everywhere. And people were personally DMing me, sending me articles on WhatsApp, on via text, and it was just a lot, like taking it in. And I just really wanted to talk about this drug. Like, what is it exactly? What does it do? How does it work? Like, what are the studies? What has the study shown? Like, I have so many questions. I have not had a chance to speak to my hematologist just yet, if I'm being honest with you. So everything I'm gonna say to you today is all off of just research, things I've read online, videos I've watched, articles, and so on and so forth. So please, if I get anything wrong, especially with saying the word Crizanlizumab, forgive me. Please don't shoot me. It's quite a lengthy word, and I'm still trying to, like, wrap my tongue around the word. So that's what this video is going to be about. So I'm excited to really talk to all of you guys about this. And I just want to say, please don't forget to share, to like, to subscribe, and leave a comment. I actually want to know what you guys think about this drug also. And I really do feel like it's a conversation that needs to be had, especially for people who are living with sickle cell disease. It's for us to discuss as well and be like, what do we think about it? Do we want to take it? Do we actually need it? Now I know the setup is a bit different, so please excuse this big mic in the middle of me, but I've just been trying to figure out how to better my audio quality and just improve it pretty much. Like, sometimes I'm not quite happy with how it sounds, so I bought myself a mic, and also I've been considering turning some of my YouTube videos into podcasts. So yeah, this is gonna be here from here on out, so please ignore. But yeah, without no further ado, let's get straight into this video. So what is Crizanlizumab? I hope I have said it right, but what is this drug exactly? Now, before I dive into that question, I just want to reiterate what sickle cell is, just in case you are new and you're watching this video and you're not quite sure. So sickle cell disease is a blood disorder which affects predominantly Black and Asian people. For Asians, they have thalassemia more than sickle cell disease, but it does affect, like as I said, people of color. So in essence, it's an antibody that blocks the binding of the blood. Let's say I'm sickling in my arm. So within this area of my arm, sometimes people's, like, parts of your body can lock, like you can't move it because of how much pain. It's like, literally, I need to do a video on what a crisis feels like. No words can truly describe what it feels like, but that's for another day. But let's just say you're sickling in your arm. So what this drug, Crizanlizumab, what it will do is, where your white blood cells, your red blood cells, and whatever else flows around in the blood, where it will block, this drug will basically unbind it from blocking up. So it will basically bounce. So instead of, like, how the blood, your red blood cells turn into a moon shape, even though it's still going to be like that shape, it just won't stick and stick and stick and then clot up, clot up, clot up, clot up, clot up, clot up. Like what a blood clot is, like when the blood kind of clots. That's, not the best example, but I'm just trying to help you guys just understand in very, very simple, English. It will just stop the red blood cells, the white blood cells from like sticking to, you know, the I guess the veins in your body. So that's pretty much what it does. Now, how do you receive this drug, Crizanlizumab? It is an IV drug which you would receive once every month, which isn't bad. At least it's not a tablet you have to pop in the morning, in the afternoon, in the midday, and at night, and then at midnight. It's not a tablet, and I hate tablets. If you know me, you know that I don't like. You have to beg me. I know I should be used to it, but it's just something you can't get used to. Can you get used to pain? No. So it's an IV treatment. And literally, this has been 30 years in the making. Literally, I've been watching so many videos and, as I said, reading articles. And it is quite fascinating, if I'm being honest with you. I'm going to talk about the study itself and where it's at, where this treatment is at. So they tested 198 people, right? They had 67 people on a high dose, 66 people on a low dose, and 65 people on a placebo. Now, placebo basically means, fake drug. Like, there was nothing in it. They were probably just giving them saline. Saline is another word for water. Yeah, that's probably what they were giving them. I don't know exactly, but basically they were not receiving the actual drug. So another thing that they said was that people on hydroxyurea who also took this IV treatment, they had a better chance. So their crisis was reduced by a further amount. So this is the stats. Everybody who took this IV treatment, their crisis was reduced by 45.3%. Now that's big, to be honest. That's almost 50% reduction of crisis, and this includes hospital admissions and also non-hospital admissions. So let's say just general pain, like let's say the aches that you have every day, the crises that you have which doesn't lead to the hospital, but you manage it at home. So everybody, it was just reduced by this amount. Now back to what I was saying, people who were on the hydroxyurea, it was reduced by even further amounts. Now I didn't find exactly how much by, but they said it was reduced even further than just not taking the hydroxyurea. So that's another thing to consider. Now, this study was for 52 weeks. So I believe that's about a year, which is, quite a lengthy amount of time, to be fair. They're absolutely like wowed by the results and everybody who took it. So this is why there's such a big fuss. Now, I just want to make this abundantly clear. This is not a cure. Again, this is not a cure. This is a treatment which will reduce the amount of pain that I will go through. Basically, it just reduces the pain. So let's say I have 10 admissions a year. This IV treatment will reduce it by half. So let's say I only go in 5 times, and even less. So as I said, if you're on hydroxyurea, lower. And just for other people, again, everybody sickles differently. Everybody it's just different for everybody. Like, we're not all the same. As much as we have the same condition, sickle cell doesn't treat us all the same way. So it may even reduce it to more than that. I may go from 10 admissions to 2 admissions a year, which is great, to be honest with you. But I just want to make it clear, it is not a cure. So if you are looking for a cure, the only cure available as of now is a bone marrow transplant. That is a guarantee. If you have a bone marrow transplant, basically you get a donor, whether from a sibling. I think, I'm not sure, don't quote me. You may be able to get a donor to donate their bone marrow transplant, and then that way your blood, your genotype will literally change from SS to AS or AA. Now, another thing that they found within this study was they gave it to everybody. So they gave it to people living with thalassemia, they gave it to SC. So if you're living with SC, this is also for you. This would also be a great treatment that you can try out and see if it works for you. I'm not promoting it, but I'm just letting you guys know that it the study shows that it works for them too. Now, they also looked at what they would call uncomplicated crisis. So that basically means if you're having like acute chest pains, so basically chest pains, priapism, if you know what that is. I think I should do a video on that because I don't think many people know what that is. But priapism, which is obviously for men, and also people with, like, I think it's their spleen, something else. So yeah, they also gave them, this treatment, and it also worked for them. So I guess their chest pains reduced, the priapism also reduced. Maybe they were having 10 a year, probably went down to 4 or 5, I don't know, but that went down. Now, of course, this treatment is FDA approved. It is no longer at a clinical trial stage. Like, it is done. It has been signed and sealed on the dotted line. Like, this drug is out. In the UK, it is out. In America, it is out. I even watched Arise News. Now, if you know what Arise News is, it's basically a news station in Nigeria. It's like really big. It's like the Sky News of Nigeria, something along those lines. Like, it's quite big. Now, I watched one of their interviews with the Sickle Cell board and head of Sickle Cell this, and just all these people, a professor, and just people who run the Sickle Cell Association in Nigeria. And they actually donated money towards funding this drug in Nigeria. So to all my Nigerian subscribers, reach out to Arise News. I don't know how they're doing it, I don't know, but reach out to them and see if you'll be eligible for this treatment, because honestly, it's looking promising. If I'm being honest with you, it's not looking bad, and this has been years in the making. So it's I guess it's worth trying. So yeah, this has been approved, as I said, everywhere, and people are accessing it as we speak. Now, as I'm in UK, I'm gonna talk about UK. Now, what they're planning to do is NHS have said that they are going to distribute this treatment to 5,000 people within the course of 3 years. Bear in mind, in UK alone, there are 15,000 people plus. At this point, I'm sure the numbers have gone up. But as of when I did my research, they said 15,000 people live with sickle cell disease in the UK. So only 5,000 people are able to access this treatment and get it for free off of the NHS. So I would just suggest that if you would like to try this drug, reach out to your local NHS and just see what they can do. Hopefully they could put you on the list. I don't know how it's done, but maybe you could be part of that. So that's quite good. I mean, over the next 3 years, I do think is quite long. But at the end of the day, I guess they want to give this treatment some time and just kind of get more evidence just as to how people take to it, what it really does. What are the side effects of this treatment? Now, if I'm being honest with you, the side effects didn't seem so bad. But of course, I don't know to what degree. It could have been every day, once a week, once a month, I don't know, but this is what was listed: headaches, back pains, muscle, so joint pains in the legs, I believe, vomiting, diarrhea. Now, nobody wants diarrhea. But yeah, those are the side effects. And again, honestly, I don't think it's the worst of them all. So this is me just explaining in basic English and in layman's terms how this treatment works. But at this point, I'm going to just insert a video for you guys to watch and just understand a bit better. And, you know, they'll use all the science words and stuff like that. So take a look at this video and I'll be back.
In patients with sickle cell disease, abnormal hemoglobin polymerizes when deoxygenated, forming the characteristic sickle-shaped erythrocytes. Abnormal polymerization, along with adhesion of leukocytes and sickled erythrocytes to the endothelium, causes vascular obstruction and tissue ischemia, leading to painful crises. P-selectin functions as a cell adhesion molecule that initiates leukocyte adhesion, mediates abnormal rolling and adhesion of sickled erythrocytes, and binds neutrophils to activated platelets, all contributing to vasoocclusion. Crizanlizumab is a humanized monoclonal antibody that blocks binding to P-selectin. The Phase 2 multicenter SUSTAIN study enrolled 198 patients with sickle cell disease who had from 2 to 10 sickle-related pain crises a year at baseline, and randomized them to high-dose Crizanlizumab, low-dose Crizanlizumab, or placebo for 52 weeks. The primary outcome was the annual rate of sickle cell-related pain crises, including acute chest syndrome, hepatic and splenic sequestration, and priapism in the high-dose Crizanlizumab group as compared with the placebo group. The rate was 1.63 episodes per year in the high-dose Crizanlizumab group and 2.98 in the placebo group. The rate in the high-dose but not low-dose Crizanlizumab group was significantly lower than the rate with placebo. Analysis of secondary outcomes found that the median time to first and second pain crises was significantly longer in the high-dose Crizanlizumab group than in the placebo group. The majority of patients reported at least one adverse event, including headache, back pain, nausea, and arthralgias, but adverse events were no more frequent with active treatment than with placebo. The authors conclude that treatment with the P-selectin inhibitor Crizanlizumab significantly reduced the frequency of sickle cell-related pain crises. Full trial results are available at nejm.org.
Now, what can we do right now? Because, as I said, this is going to be within the next 3 years, and after that 3 years, I don't know how many more people they would allow this treatment be accessible to. They might say another 5,000 people, then another 5,000 people. We don't know, and anything, to be honest, can change. They may get some data that actually this treatment is bad and we need to cancel it and it's no longer good. So while all of that is going on and while all of that is great, and you know, there is hope for us, and you know, science is breaking through, and honestly, I do believe in science. I do believe that God created science. Like, God has given these people the wisdom and stuff to be able to create all of these treatments, medicines, and so on and so forth. But with that being said, there are still things that you and I can still do. Now, if you are not living with sickle cell disease, the number one thing that you can do to help anybody who lives with sickle cell is give blood. Giving blood is one of the most effective ways to help people living with sickle cell disease. Now, when you donate blood, what that basically does is we are able to have blood transfusions and also blood exchange. So how blood exchange works is, again, I'm just going to explain in layman's terms. What it does is there'll be a big machine that will drain out about 80 to 90%, give or take. Again, I don't know the exact figures. It will drain out my blood. So in one arm, they'll drain out all all my sickle blood, all my bad blood. And when you see it, it looks like brown. It's like really horrible, honestly. It just goes to show how unhealthy our blood is. And then in another arm, they will give us blood. Now, basically, that will completely transform our living experience and would improve our quality of life, because quite literally we are having new blood, like literally having new blood running around us. Now, I personally, I don't take blood exchange, only because, why don't I take it? Well, I'm very particular, and I'm very like fussy, and I believe every like 4 to 6 weeks I would have to take blood, and it takes a long time. It takes hours, and my veins are not good. So I've had to have a femoral in my groin. I've had to have a femoral line in my groin, and I've been traumatized. I will do a video on that, but I am traumatized. I had one really, really bad experience, and I just don't want to have to put myself through that again. And just knowing that I'm taking someone's blood every 6 weeks is just, I don't know, for me, I'm okay. I have had it, like, let's say twice in my life, or 3 times at the most, and that's it. In regards to blood transfusions, I've had that quite a few times. Let's say I'm having a really, really, really bad crisis and I'm in hospital and nothing is like working. My blood count is just dropping, going lower, 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 and like just things up. It's usually when I am I'm not improving in any way, then they may give me a bag or two of blood. So that's just my own personal thing for when it comes to blood. Now, also, one thing I want to add is black people need to donate blood more. We have other people from other races, Caucasians, Asians, whoever, donating blood, and as that is great, and I am thankful and I'm grateful for everybody who donates blood, but it is more important for black people to donate blood, because they've said, the studies have shown that when a black person donates blood to obviously a black person with sickle cell disease, it's better for them. Like the chances of your body rejecting it, and just it lasting longer, and just all these things, it's just a better chance. And I guess it makes sense, if the person donating is black and I'm black, then obviously there's something in black blood that helps and will make it better. So please, please, please register to give blood. It doesn't take much, and you are saving lives. Literally, you are saving somebody's life. So please bear that in mind. So to wrap up this video, I'm just going to give my thoughts, my personal Emanuela's thoughts and opinion. You don't have to take it. You don't have to follow me. Please, I don't want you to just take on what I'm saying and just run with it. Do your own research. Have an understanding for yourself. Speak to your own hematologist, doctor, and go from there. Now, my own personal opinion is, I feel like this is great, right? I think it's been a long time in the making that a treatment like this will be out to help people living with sickle cell disease. Am I willing to take it? No. I'm so sorry. I have been on a clinical trial before. I have mentioned this once or twice before, but I've not yet showed you guys the video. I was on a drug called Imara. Now, this was a tablet, 1 tablet a day that I would take. And in essence, what it did was it boosted your baby hemoglobin by, I think, about 50%. So I was on 50% dose, and then they upped it to 100% dose, and in total I believe it my baby hemoglobin by 50%. So the fact that I've already been on a clinical trial, I am not a guinea pig. Do you get? I'm so sorry. I'm not going to be the one that will try every drug for the scientists to know that, yes, Eureka, we have found the ultimate treatment or drug. So for those reasons, and just because I need to understand it a bit more, I will not be taking it. If I change my mind, I will let you know, but for now, it's a no. But again, it sounds very promising. It's looking really good. And honestly, the data is there. Read it up for yourself. It's looking really, really good. So I've come to the end of this video. I hope you guys have enjoyed this video. Apologies if this video is a bit long, but I really needed to break it down bit by bit so you guys understand. But thank you again for watching. Please write a comment. I want to know your thoughts. If you're on it, let me know. If you're thinking about taking it, let me know. And if you have any questions, also let me know. So yeah, please share, please like, please subscribe, and leave a comment. Thank you and take care.